Woman who used heroin during her pregnancy got clean for herself and her daughter. Alana?
For one expectant mother, an arrest led to a hospital stay. A few words from a healthcare worker there helped her stop using heroin more than 7 months into her pregnancy.
I enjoy being with her more than anything in the world.
Victoria Warden can't spend enough time with their daughter Liliana. Warden's drug use that started after a car wreck almost kept her from a life with her little girl.
I was given prescription painkillers, and I was given a lot of painkillers.
Warden says she was naive about the oxycodone's strength.
What drawn me to it so much was that not only did I not feel pain, but all of a sudden I was really happy. Right? Like all this depression and all this stuff that I'd been going through, maybe some postpartum depression, I'm not sure, but that was gone instantly.
As Warden's drug problem got worse, she got better at hiding it from her husband and 2 young daughters.
I'm doing normal things, but I have this whole secret.
A secret life that involved buying pills from friends, neighbors, and even the mothers of her children's friends.
One day, I have a husband and kids in a home, and 2 months later, I have lots of warrants. I don't have my children. I don't have a husband. And if I don't use, I am really violently ill.
Not long after, Warden started using heroin intravenously. She got pregnant again and was still using heroin. She didn't know how to stop.
You already know that you're wrong. You know that this is not okay. You know you don't want to do this. You know you're pregnant with this baby and you're doing the worst of the worst thing you could do.
When babies are born to mothers who use prescription or illegal opioids during pregnancy, they're at risk for NAS, or neonatal abstinence syndrome. It's withdrawal from the drugs. The CDC says nationally, the number of babies born with NAS increased 5-fold from 2004 to 2014. There's a baby born with NAS every 15 minutes.
Not all babies who are exposed to those drugs actually experience withdrawal. It's really hard to predict.
Dr. Jody Jackson is the medical director of Shawnee Mission Medical Center's NICU and a neonatologist at Children's Mercy's Department of Pediatrics. She cares for babies with NAS. She says symptoms of NAS include shaking, problems eating and sleeping, and excessive, inconsolable irritability.
We can do what we call comfort cares, which is things to just make them more comfortable, swallowing them more tightly, feeding them more frequently.
Sometimes care for a child exposed to drugs means children will go into the foster care system.
Took in 3 infants.
Stacy Mays, who lives in Blue Springs, adopted those babies, 2 of whom were born exposed to drugs.
One of them was on a medication that I had to pick up at Children's Mercy every week because he would projectile vomit.
Mays relied on a support system of pediatricians and social workers from Foster Adopt Connect.
What there is a correlation between those opioid-related deaths and the number of children coming into foster care.
Foster Adopt Connect's president Lori Ross says that's a big deal for an already overtaxed, overburdened foster care system. Warden's daughter never left her custody.
I will let her know that Mommy went through some really tough times and I overcame it with the help of some really cool people, and that's why she's got such a good life.
The quality of life they have now started at the bottom. Police arrested Warden while she was pregnant, and she went to the hospital for a pregnancy-related condition, and it was her first time getting proper treatment. A social worker told her there was help available.
She was just like, you don't have to live this way. You don't have to be like this. You can get your kids back. You're not, it's not over.
She started treatment, and on March 6, 2017, a few days after she finished treatment, she gave birth to Liliana.
She was born on time, and she was perfect. She was really pretty, and I was on methadone, right, from that last couple of months. So they had to give her a little bit of morphine for a couple of weeks.
Warden and her 3 daughters live together at Amethyst Place, a group that supports women in recovery and their families. She has a job, she's in school for social work, goes to Narcotics Anonymous meetings, and doesn't have any legal trouble. Above all, she now has 2.5 years of sobriety under her belt.
I mean, I've been in situations where I had more money, and I've been in situations where I had more stuff. But I'm pretty taken care of. There's nothing that I can't do, when I'm clean.
Dr. Jody Jackson is trying to develop a standard of care and reporting for NAS through the Kansas Perinatal Quality Collaborative. In Kansas, she's been able to collect data from 85% of births in the last year and a half and says since then, the standardized comfort care reduced the need for other medical treatment as much as 80% in some birth centers. Alana LaFlore, Fox 4 News.
According to the CDC, babies born with NAS are more likely to have developmental speech and language delays in early childhood.